class. My name is Emily Lichtenberger, and for this PowerPoint presentation, I will be reviewing health leader evaluations. I have two that I'm going to go over that kind of hit close to home for me and how I am evaluated as a leader at my health organization. For the first leadership evaluation model that I want to go over is transformational leadership, the construct model. This has 5 different areas in it that really drawed me into it as I was reviewing it and kind of the ins and outs of it. So the first one is governance, and that sits up at the top. You've got your strategy, your leadership development, your talent management, and then also your outcome. So with governance, you're ensuring leader behaviors match the organizational compliance and core values. You hold transparent conversations, and you hold accountability and decision-making framework. So meaning you, if you have your team implement a new workflow, you ask them why behind, hey, we implemented this new workflow. Why are you not doing this? As it pertains to governance too, you can also use like corrective actions with employees as well, or the need to change a workflow. You then have the strategy, which is clearly articulating the vision, discussing uncertainties, barriers, and risks up front during the planning. It's also change management. So sometimes you have to really hone into that change management to measure whether the strategy is working or not. Is this new decision, or is this new, problem that we just solved working, or is it not? You then have your talent management. Talent management provides coaching and professional growth plans, identifying and developing high potential leaders, and expressing exceptions. So with this one, this is going to be, someone's always told me, if you want to move up, who are you going to have take your position that you're currently in, or who do you foresee, who are you kind of mentoring to help coach to get them to that next level within their career path? So when I moved positions last October, that was one of the questions I was actually asked in my interview was, who do you have ready to go or in mind for your admin assist position? And I had let them know. And when I got this position, actually that person that I had said and kind of helped coach and mentor and give positive feedback to of, you can do this, she accepted my old position. And then you have the outcome. The outcome is going to measure the growth, the culture, and efficiency improvements. Are you moving the needle forward, or is it staying stagnant, or is it going backwards? So this picture here is a chart of the transformational leadership development construct model from our book. You can kind of see how everything's laid out. So we'll go through it here. So you've got your governance at the top. Then you come down to your strategy. You really want to get with legal and get with the policies and procedures to measure if your strategy is in alignment with what your organization has. You then have your leadership competencies, which goes down into talent management. You've got recruitment and selection, job design, performance management, rewards and recognition, succession plan. And then when you go from your leader competencies to leadership development, you then go to your outcomes, and that gets you back to the top where the governance is. Your strategies and outcomes, you always want to make sure are good to go when it comes to the legal system and keeping that in mind. But then you also have your talent management where that goes up to your outcomes as well. So for this one, I have kind of an example. So how is this change when it comes to transformational leadership development in this model going to affect the different job codes? So you've got patient office specialists, CMAs, RNs, managers, directors, CNO, COO, CEO. All are within a different matrix on the quote unquote totem pole. So you start with your clinical staff, then that goes up to managers, your directors, and so on and so forth up the totem pole. And we're all held to a different standard than the other. So this is an individual group focus, not an individual focus. The measures are going to be through action plan assessments, annual performance evaluations where you assess your year and how well you did, and your one-up will then assess your year and review it with you. You can also measure recruitment based on 6 months, 1 year, and 2 year employee retention. You can celebrate the recognitions, assessing degrees or organizational leadership learnings that have been completed. So within my organization, I go through like talent acquisition evaluations every 6 months. My director takes it up to his one-up on the physician side, and they review how well I'm doing as a leader and where I can go as a leader as well. But then you also have your RNs and your CMAs. They all have a certain scope they have to be in, so therefore that's all what their group is going to be evaluated on in their performance. For the second healthcare evaluation model that I chose to review is another one that I truly appreciate, and one that is focused more towards my leadership style and how we assess things within the healthcare organization that I work for. So this is leadership development, the process and approach. So you have your create, focus, define and activate strategy, engage the organization, and drive results. And this kind of reminds me of just like an SBAR, honestly, because with an SBAR, you create the focus, what's the situation, you define and activate the strategy, you go through the background of, whether it's an issue that you're trying to improve or whatnot. And then you have your engage the organization assessment. So you're going to tell the, why behind what the process and approach is when it comes to engaging the organization. You're going to assess the situation in SBAR, and then you're going to go through your results or recommendations. So you're going to drive the results, and then you have your recommendations in an SBAR. So for the create focus portion of this, you're going to prioritize clear goals, create a habit, organizational alignment, and clearly define the why and consistency. Consistency is key when it comes to creating a focus, staying consistent with your staff, really being that positive aspect to them and keeping the negativity out of it. But defining that why is what you really want to do when you create the focus on this leadership development approach. You then have define and activate strategy. So you're going to write clear plans, share the vision, give the tools. It's going to be everything that, say, the managers need to go ahead and get their department engaged in whatever it may be. You then have engage the organization, trust builder. That's going to be you as the manager saying why we are doing this. It's going to build trust that the employees are trusting that you're going to guide them or lead them through the gray or lead them through the clear. It just depends on what the issue is. You're going to listen to your employee feedback during this time. You're going to support growth. You're going to have succession plans, staffing initiatives, and integration. You're really going to collaborate with your team. And as long as you're the type of leader that I am, it's not easy for everybody, so I can't really say that. But the type of leader that I am is very positive. I find the glass is half full instead of half empty. And that's what helps build my team's trust. That's how they know that when I come to them with something, I'm going to clearly explain it, clearly define it. We're going to move forward. And then next, you're going to drive results. You're going to drive results. You're going to see what the barriers are. You're going to have touch bases with your team to do monthly and quarterly reviews. You're going to track your progress, change management, continuous learning, and then mitigate barriers and risks and reward the successes. Right now, we're going through a phase where our hypertension care gaps are sitting at a 2.0 and we need them to be a 3.0. And so we are constantly reviewing these with quality. We're putting in little initiatives to help move that needle forward. And we are, dividing and conquering when it comes to barriers and risks that we're seeing. But then I'm also rewarding the success of, hey, you guys, we've gone from a 2.0 to a 2.2 in a month's time span, and that's great. So here is the chart from our book that shows the leadership development process and approach. So you've got your 4 topics, main headings up top, and then under create focus, you've got your operating calendar, your strategic initiatives, define and activate strategy. You've got your strategic plan, operating plan, goals and objectives, engage the organization, values and mission statement for the organization are extremely pertinent when it comes to this column. Performance management, talent reviews, and then your drive results, your operating reviews, and your skill development. So this type of leadership development is an individual focus, not an individual group focus. Every leader is different and chooses to organize, plan, and operate differently. While operating, planning, and organizing differently, we are all held to the same standard and reaching for the same goal. So this can be measured by, let's go for budget. We do our budget every year. So something that can really do this is, or measure this per se, is going to be your actual versus budgeted reviews. When you go through your budget monthly and you have to speak with the finance team because you're over budget, how are you helping mitigate being over the budget as a leader? Provider productivity. So this could be anywhere from, your individual providers, and not just yourself. They are held to, they need to be at the 60th percentile in productivity. So what are we doing to help our providers ensure that they're at that productivity? Open access. We can give them all the tools we want, but it's up to them to make sure that their productivity is where it needs to be. Growth, open access template optimization, patient satisfaction surveys are a good way to help with this leadership development as well, especially when it comes to a provider. While we have a department survey, we also have individual surveys as well. So some similarities of transformation and process and approach evaluation styles. So individual focus, talent management focuses on one employee's growth. There's long-term vision and goals. It helps review yearly and career-long goals. Step by step, they are continuous learners mindset, gives leaders a chance to go back to school or take smaller learnings that hit key aspects that they want to grow in. For example, crucial conversations, leading in the gray, going from an employee to a leader role. Motivation, it gives leaders something to look forward to. Growth goes hand in hand with continuous learners or also with motivation. Leaders are also excited to see, I know I am as a leader, their employees succeed and excel in their growth too in their career. And then collaboration. So this can be internal or externally. We're all in it for the same goal. So we can, we collaborate with the community to make sure that the access and the outside of the office community events that we do are pertinent to what our community needs are. And then differences of the two. So you have, first off, your transformational leadership, the construct model. So it's an individual group focus. Manager, for example, while there are different types of leaders, most of their organizational goals are aligned. It provides a more ethical approach. Legal aspect is involved when necessary. And then your outcomes. While quality metrics may be the same for each provider and clinic, the outcome or how the provider and clinic get to the metric percentage can be different. And then you have your leadership development process and approach. So it's an individual focus, how, you get to figure out how you want your schedule to be and what is most important to you and the employees or clinic that you lead. You have clearly defined goals and objectives, so collaboration and including all necessary departments. We are all in healthcare for the same reason. And then holding those monthly and quarterly reviews to go over risks and barriers. And then you have your strategic initiatives, which are clearly defined. You're in alignment with the organization. So for example, template optimization, 15 30-minute appointments and 20 40 appointments. So even though, again, we're in one organization, the leadership development is based off the individual and what each provider is doing or person within that healthcare organization. Thank you for listening to my presentation. I feel like both of these um, evaluation types hit home for me. However, the process and approach one is more of my style. I like to do my own thing, organize my own things, but I also have, my own career goals. But while I'm doing that, I'm focused on my team's goals as well and encouraging them and getting them the um, proper tools that they need to either move forward in their career or just improve, their nursing skills or their registration skills.